to our health class. Today, we are going to discuss how poor environmental sanitation can negatively impact the health of an individual. What is sanitation? Sanitation is the process of keeping places clean and healthy, especially by providing a sewage system and a clean water supply. It is also the provision of facilities and services for the safe disposal of human urine and feces. Here are some key facts related to sanitation. In 2010, the UN General Assembly recognized access to safe and clean drinking water and sanitation as a human right and called for international efforts to help countries to provide safe, clean, accessible, and affordable drinking water and sanitation. According to the World Health Organization, over 600 million urbanites live in low-quality shelters or other areas plagued by overcrowding and inadequate provision of sanitation services. 2 billion people still do not have basic sanitation facilities such as toilets or latrines. Of these, 673 million still defecate in the open, for example in street gutters, behind bushes or into open bodies of water. One type of sanitation is environmental sanitation. Interventions that reduce people's exposure to disease by providing a clean environment in which to live, with measures to break the cycle of disease. This usually includes hygienic management of human and animal excreta, solid waste, wastewater and stormwater, the control of disease vectors, and the provision of washing facilities for personal and domestic hygiene. Environmental sanitation involves both behaviors and facilities that work together to form a hygienic environment. On the other hand, poor sanitation refers to the absence of sanitation. It is when people who live in a particular setting don't have access to safe water, good sewage, and live in a dirty environment. There are many factors that cause poor sanitation. First is urbanization. Poor sanitation is one of the most accurate indicators of urban poverty and health problems. As people continue to migrate from rural areas to urban areas, new kinds of slums, the squatter and informal housing all around are rapidly expanding. Another cause is poverty. Poverty is one of the greatest challenges every government is facing. People living in informal settlements are characterized with extreme deprivation of basic human needs, especially service provision. Another is inadequate water supply. Lack of sufficient water supply has led to unofficial ways of accessing water services. This has in turn led to access of unhygienic water for the people, which exposes them to waterborne diseases. Next is inadequate planning. As population increase, more pressure is put on the capacity of urban cities to provide services to residents. High cost of housing, transport, healthcare, and sanitation have led to growth of slums and informal settlements, thus leading to acute drainage and sanitation problems. The poor drainage and sanitation system has contributed to the emergence of breeding sites for mosquitoes and flies. Another cause is poor governance. In all aspects of urban development, the role of local government is very important. If done poorly, it may not provide the services the people need. What does poor sanitation cause to our health? Poor sanitation is linked to transmission of diseases. Some 827,000 people in low and middle-income countries die as a result of inadequate water, sanitation, and hygiene each year, representing 60% of total diarrheal deaths. Poor sanitation is believed to be the main cause in some 432,000 of these deaths. Poor sanitation reduces human well-being, social and economic development due to impacts such as anxiety and lost educational opportunities. Open defecation perpetuates a vicious cycle of disease and poverty. The countries where open